mercury of partial pressure oxygen. As a nurse, and I won't even knock on the wood because I know we'll be future nurses soon. The question is, what would be the diagnosis if you will be the nurse?
Acidosis.
Exactly. So that just means that one of the complications in diagnosis under the respiratory acidosis is none other than the COPD, which stands for chronic obstructive pulmonary disease. Now, chronic, which means long-term, obstructive, which means airway blockage of the lungs, and pulmonary, which refers to the lungs. So in other words, COPD is a long-term lung disease that is characterized by difficulty of breathing caused by the presence of excessive mucus, bronchial inflammation, and a loss of elasticity of the lungs. Now, according to page 330 of our book, which is the Medical Surgical Nursing Consultant Practice, and the National Center of Health Statistics of 2006, approximately 16.8 number of people, which makes it the fourth leading cause of death in the United States, in America has this kind of disease, which is the COPD. Now, smoking and AAT deficiency, which is the alpha-1 antitrypsin deficiency that will be discussed later on by Ms. Tatiana, as she discussed to you guys about the risk factors of this disease, are the primary cause of COPD, with air pollution, occupational exposure to irritating fumes, and chemical or industrial chemicals as contributing factors. Now, COPD is also a term that is used to describe a condition of two diseases, which includes the emphysema and chronic bronchitis. So let me talk to you guys first about chronic bronchitis. Now, the air you breathe in your lungs is the air that you breathe is delivered to your lungs through two large airways, which is called the bronchi. Now, in chronic bronchitis means that there's an inflammation in the lining of the bronchial tubes. In chronic bronchitis, there's an excessive mucus secretion. That's why it interrupts the airflow and the inflammatory damage of the bronchial mucosa. That's why it produces a productive cough. Then inflammation is considered as chronic when the recurrent cough is present for at least 3 months of a year for at least 2 years. Now, COPD or chronic bronchitis, can be ranged from.
At least you guys are awake. Okay?
The chronic bronchitis
Dalaga ka
can
na,
be
Maxi.
ranged from into a mild, irritating cigarette cough in the morning that produces a small amount of sputum into a severe disabling condition.
Okay.
Now, the latter extreme is characterized by the increased inflammation or the increased resistance of the airflow, hypoxia, which means low level of the oxygen needed into your body, and hypercapnia, which means excess carbon dioxide. And the last but not least is I don't know if this is really pronounced this way, but I pronounce it as cor pulmonale.
Oh, yeah.
It is a heart condition that is characterized by pulmonary hypertension and enlargement of the right ventricle, which is also the which are the second cause of a lung disease, or chronic lung disease to be exact. Now, this called cor pulmonale can make your patient be at risk for right-sided heart failure. And also with chronic bronchitis, there is a airway blockings which may lead or make your patient easier to get an infection. That's why one of the treatments is the antibiotics to prevent the infection that will be discussed later on by Ms. Sunshine Julio. Now that I've already discussed about the chronic bronchitis, let's move on to emphysema, the last but not the least disease under COPD. Now, emphysema is essentially the one of the disease that is under the extreme, in extreme or in extreme respiratory unit. Now, for emphysema, as the same, the air that you breathe that is delivered to your lungs is or passes through two large airways, which is called the bronchi. Now, this bronchial airways divide in can and a can and a can until they will reach the 500 million tiny elastic air sacs, which is called alveoli. Now, this alveoli is the one that transfer oxygen and carbon dioxide into your lungs. When you have emphysema, this kind of disease destroys the air sacs in your body as well as, or into your lungs, as well as the blood vessels and the supporting cells, which may lead into a large and permanent inflation of the alveoli air sacs. Now for sorry.
Wala na.
For emphysema, now this will also lead to what do you call this one? To the airway blockage because of some of the extra mucus, and because of this airway blockage, the air that you inhale is trapped. So that's why when the air that you inhale is trapped, then that means that it will give you more